The patient is a 21-year-old female who presented to the office with complaints of frequent burning and painful urination. The patient reports that she feels the need to void 3 or 4 times every hour. She states she's having cloudy urine with a strong smell. She denies nausea, fever, vomiting, flank pain, hematuria, vulgar or vaginal irritation, or vaginal discharge. The patient denied any previous history or similar experiences, no significant childhood medical history, and she has a history of frequent sinus infections. The patient reports she has never been pregnant, no reproductive disorders or concerns, and states she used birth control, including Depo-Provera, since becoming sexually active at 18 years old. The patient stated that she used spermicidal pregnancy prevention before the last Depo-Provera injection because she missed her scheduled appointment. Her last OBGYN appointment was 8/10 of 23 with no significant findings. Review of systems. Constitutional denies fever or chills, recurrent fatigue or malaise, headache, sweats, anorexia, fatigue, weakness, or weight loss. Ear, eyes, nose, and throat denies vision changes, light sensitivity, eye pain or irritation, double vision, vision loss, hearing changes, ringing in the ears, ear pain, nosebleed, nasal discharge, nasal congestion, long healing sores, sore throat, difficulty swallowing, tooth pain, non-healing sores or oral lesions. Cardiovascular denies chest pain or pressure, shortness of breath with normal activity, elevated blood pressure, difficulty breathing with lying flat, shortness of breath at night, shortness of breath that wakes you up from sleep, palpitations or sensation of heart beating in your chest, swelling in the ankles, lightheadedness or weight gain. Respiratory, the patient denies shortness of breath at rest or with exertion, cough, productive cough, difficulty breathing, wheezing, excessive snoring, shortness of breath, excessive sputum, chest discomfort, coughing up blood, sleep disturbances due to breathing. Gastrointestinal denies heartburn or acid reflux, difficult or painful swallowing, nausea or vomiting, diarrhea, constipation, abdominal pain or cramping, bloody or black bowel movements, excessive appetite, loss of appetite, indigestion, nausea, gas, hemorrhoids, and change in bowel patterns or habits. Genitourinary reports she was having a painful or difficulty urinating, frequent urination for the last 3 days, denies blood in the urine, incontinence, urgency, incomplete emptying, and hesitancy with urination. Musculoskeletal denies joint pain, tenderness, or swelling, and denies changes in strengths. Neurological denies frequent dizziness, fainting, weakness in arms or legs, numbness or tingling in arms or legs, headache that are new or changing in frequency, difficulty with concentration, memory loss, sensation of room spinning, tremors, visual disturbances, weakness, inability to speak, and seizure. For psychiatric, denies depression, hopeless, anxiety, feeling stress, panic obsessing, sensitive, suicidal thoughts, mental disturbances, hallucinations, financial hardship, not feeling safe at home, social problems that interfere with your mental health or physical health. Physical examination. Patient is appropriately dressed, appearance is clean and kept. Patient is a thin, white female, does not appear to be in distress, and patient is alert and oriented ×3. Ears, nose, and throat, there is no swelling of the tongue observed. Mucous membranes are moist and pink. No deformity or lesion of external ear. Canals and tympanic membranes appear normal bilaterally. The tympanic membrane intact and not inflamed with normal light reflux. Normal oropharynx and posterior pharynx without lesions of exudates. The neck is supple, no masses or palpable cervical nodes. Trachea is in midline, thyroid without nodules, masses, tenderness, or enlargement. The lungs showed mildly diminished breath sounds with prolonged expiratory phase, no added sounds. Cardiovascular, there was normal S1 and S2, no rubs, no gallops, no murmurs or carotid bruits. Musculoskeletal, no muscle pain or weakness. And the skin is warm, dry, and intact. Genitourinary showed a suprapubic tenderness noted on palpation, and the neurologic, she was grossly normal. For her vitals, her blood pressure was 118/78, her pulse was 72, respirations were 18, temperature was 98.6, and O2 stat was 96% with a weight of 181 and a BMI of 28.3. For diagnostic studies or tests, lab tests were ordered, and the lab work that was ordered was a dipstick urinalysis, which showed positive for leukocyte, esterase, and nitrates. A urine culture was also ordered, which was still showing that it was pending, and a CBC was ordered, which showed no elevation in the white blood count. What can cause urethral pain? It can be anything from skin conditions, urinary tract obstructions, a UTI, food and medications, urethritis, or trauma. For my differential diagnosis, I included a urinary tract infection, which is an infection in any part of the urinary tract, the system of the organs that makes the urine. And the urinary tract infections often start when bacteria get into the urethra. Most UTIs involve the lower urinary tract, which include the bladder and urethra. Risk factors include being born female, using diaphragms or spermicides for birth control, and having blockages in the urinary tract. UTI symptoms can include a strong urge to urinate that will not go away or a burning feeling while you urinate. The urine may look cloudy, red, bright pink, or cola colored. It may also have a strong odor. Sometimes UTIs cause no symptoms at all. Pyelonephritis is the medical term for kidney infection, which can include one or both kidneys. Most kidney infections start with bacteria that enter the tube through the urine, leaves the body through the urethra. Pyelonephritis can occur as a complication of an ascending or untreated urinary tract infection. The germs will then multiply and spread to one or both kidneys. Risk factors include being female, having a weakened immune system, and getting a blocked urinary tract due to a problem such as a kidney stone. Symptoms of a kidney infection can include fever, chills, upset stomach, or vomiting. It can also lead to the pain in the back, side, groin, or belly. Peeing may cause a burning feeling or pain. A person may need to pee often, and the urge to urinate may feel strong and long lasting. The urine may contain pus or blood, and it might smell bad, or appear cloudy. An overactive bladder is a problem with bladder function that causes the sudden need to urinate. Overactive bladder happens mostly in women, but also occur in men. Aging, an enlarged prostate, and diabetes can all be risk factors. The urge to urinate may be difficult to control and lead to the involuntary loss of urine or incontinence. It may lead to impairing or limit activity. And lastly, vaginitis, which is an inflammation of the vagina that can result in discharge, itching, and pain. Vaginitis is usually caused by change in the normal balance of vaginal bacteria, an infection, or reduced estrogen levels after menopause. Symptoms include unusual vaginal discharge, itching or irritation, painful urination, and pain during intercourse. In this case with our patient, the patient appears to have a urinary tract infection. The diagnosis is based on the patient's chief complaint, history of present symptoms, and the dipstick urinalysis culture and the physical examination findings. Clinical indicators of a UTI include urinary urgency, dysuria, and suprapubic tenderness. Pyelonephritis ruled out because of absence of nausea, vomiting, flank pain, and fever. The overreactive bladder was ruled out because of dipstick urinalysis results, and vaginitis was also ruled out because of absence of vaginal discharge, vaginal or vulvar irritation, and due to urinalysis dipstick results. The patient will be treated on the following medications. She'll be started on Bactrim DS orally twice a day for 3 days. We will continue with routine monitoring and ongoing care by educating the patient on the importance of completing a full course of antibiotics, educate the patient on perinatal hygiene, including wiping front to back to prevent the spread of bacteria to the urinary tract, advise the patient to drink at least 8 glasses of water each day, reiterating that water discharges the growth of bacteria by flushing the urinary tract, educated the patient to avoid the use of spermicidal products as they decrease vaginal lactobacilli, which will increase the risk of UTIs. The patient is also instructed to follow up if she is continuing to have symptoms after she completes her round of antibiotics for 3 days.